So good afternoon. Welcome to the Stanford Health Care Nurse Residency Program Interview Preparation Webinar. I am Kerry Zoss, and I'm the Nurse Residency Program Coordinator, and I am very excited to be joined by all of you this afternoon to talk about how you can be successful during the Stanford Health Care Nurse Residency Program interviews. So today's objectives are pretty straightforward. The goal is you have an understanding of what that interview structure will look like. You will understand the key features of our behavioral interviewing style. You will be able to articulate strategies to successfully prepare for your interview. And then we'll touch base. After we cover that, we'll touch base and move forward and talk a little bit about the program for those of you who may not be as well versed. What is the overall goal, structure, and curriculum of the nurse residency program at Stanford? And then we'll allow that open dialogue between myself, Kevin, and Carly within our talent acquisition department, and then our current nurse residents who are joining us this afternoon. So in terms of the panel interview schedule, so some of you who are on this call may have been called to participate in our panel interview schedule. This is our panel interview schedule as it sits right now. We are interviewing over 4 days at the end of the month. Those 4 days are going to run from Monday, January 24th through Thursday, January 27th. Human Resources is currently reaching out to candidates to fill those spots. So they started last week and it has continued into this week. On those panel interviews is an assigned facilitator. That is a nursing professional development specialist who works within the Center for Education at Stanford Health Care and supports the residency program. So as you can see, there's a variety of us, myself included, who will be facilitating your interview. The number of candidates to be interviewed really depends on the number of candidates to be hired. So in our critical care and oncology regions, those panel interviews are each going to hire 40 with the, each going to interview 40 with the goal of hiring approximately 15. Our surgical and medicine areas are larger, so each of those is going to hire 40, but we have doubled the amount of panels. So it's really 80 for surgical, 80 for medicine. And the goal is that they will hire approximately 30 each. Our peri-anesthesia area, which is the pre-op PACU area, is going to interview 20. So will float pool, so will clinical trials, which is our research area, and then inpatient psychiatry. And each of those departments is looking at hiring a minimum of 2. So that is the structure as it goes forward at the end of the month. So for those of you who had questions on how many were being interviewed and what is the hiring look like, that is the tentative schedule as of now. So what is the interview structure? So there is a panel interview that you will participate, and then there's what's called a unit or department level interview. So the panel interview is what's going to happen at the end of January, starting on the 24th. It is a virtual interview, and you will interview per the specialty area that you selected as your top 1, 2, or 3rd preference on your application. So if you're interviewing in oncology, all of the hiring managers who are hiring for oncology will be present on that panel. If you're interviewing in critical care, all the hiring managers for critical care will be on that panel, and so forth, which each specialty. There will be 4 prospective candidates on each interview panel. So there will be a facilitator, the hiring managers, 4 candidates on that Zoom interview. All the questions will be behavioral style interview questions, and we'll talk about that as we move forward in this presentation. What does that look like and how to prepare? Because we run these interviews concurrently and we're trying to move through a large volume of candidates, there's not an opportunity for you to ask specific questions during the panel interview. You will be given instructions on what is the process following your panel interview, so you will be prepared on what's to happen next. But all of those questions that you have, we ask you to save them. And should you be invited to a unit level or department level interview, that would be the space to ask those questions. So following the interviews, for example, critical care will interview on Monday the 24th and Tuesday the 25th. Around 4 o'clock on the afternoon of the 25th, those hiring managers have listened to all 40 candidates, and now they're going to go through and review those candidates. And should a manager feel like you would be a good fit for that unit that they are the manager of, they will reach out to you by phone and invite you for a unit level or department level interview. What does that look like? That is also a virtual interview. For those of you who work at Stanford and are internal, you may be invited to an in-person interview because you have met all of the COVID requirements, but for all others, it will be a virtual interview. It will be yourself, the hiring manager who sat on your panel interview, and that hiring manager may invite members of their team. So perhaps their assistant managers, their educator, their clinical nurse specialist, perhaps some clinical staff may sit on that interview. That structure is left to the discretion of the managers. The goal is really to have one candidate per interview, so it's a little bit more of an intimate conversation between you and that hiring department. Again, it will be a behavioral style interview structure, but there's also opportunities for some more candidate specific questions. Perhaps what brought you into nursing, tell us three of your strengths and 3 areas of opportunity. And then there's going to be time for you to come and ask all of those burning questions that we know you have. So at the end of that interview, they will invite you to ask any questions related to the unit, the team dynamic, the shift, what does orientation look like, any of those questions that you have and that you would like to be answered. Following the unit level interviews can start as early as Wednesday, the 26th for some of our specialty areas, but will conclude no later than February 4th. And on February 4th, all managers have to let human resources know who they would like to offer the position to. So you will be either hearing the very end of the week on Friday, February 4th, or very early the following week, whether or not you were offered the position. So that is really the logistical structure of the interviews. I hope that clarified any questions. For those of you who are invited to the panel interview, the interview is 1 hour in length. You will log in via Zoom. We ask you not to log in more than 5 minutes before. And the reason being is because the interviews are in process. And so you'll be sitting in the waiting room until your start time. So when you log in, know that you'll be in the waiting room. We wait for all the candidates to join us in the waiting room, and then we invite all of you in at the same time. We welcome you. We provide you with introductions for everyone who's on the panel, and then instructions on what the panel will look like, it will be a series of behavioral style interview questions, and the facilitator will be running the interview. You will be asked to introduce yourself. What you say and what you share with us is up to you. We encourage you to share with us part of that nursing journey, perhaps the school that you attended, maybe if you had a senior clinical preceptorship or where your last clinical preceptorship was, share that with us. Any work or volunteer experience, and perhaps why you are excited to interview in that specialty area. But really what you share with us is completely up to you. We just ask for that introduction. Then there will be a series of behavioral style interview questions. There are only 4. If there are 4 candidates on the call, you will all be asked the same 4 questions. The manner in which we ask those questions will rotate. Therefore, you will only hear a question asked to you for the first time once. All of the other questions that will be asked to you, you will have heard because another candidate had been asked those questions. So take a breath, introduce yourself, 4 questions, and then we conclude. So the interview is quite brief, which is good. So really it's an opportunity for you to introduce yourself, connect with your audience, share some information about yourself through these behavioral interview questions, and then we'll conclude and provide you with next steps. So the question I get all the time is, Kerry, what do I need to do to be successful? So I'm going to share with you some strategies and some tips and try to calm the nerves a little bit, so you can be really successful during your behavioral interview, especially at the panel level. So what is behavioral interviewing? For those of you where this might be a new term or you have not had the opportunity to be involved in a behavioral interview, that's okay. Behavioral style interviewing focuses on a candidate's past experiences. And we do so by asking you to provide us specific examples of how you have demonstrated certain behaviors, knowledge, skills, or abilities, all that happened in the past. So all of your answers will provide concrete evidence on how you have dealt with something in the past. And the reason we ask this is because it serves as the best predictor to determine how you will respond given a similar situation in the future. So my ask for all of you is when you are asked a behavioral style interview question, take a minute to think of an experience. Don't stop and say, I don't think I've had that experience. This is what I would do. That is not answering the question. The question is not asking, what would you do? It's what did you do? That is the focus of the question. So we'll talk a little bit about how to prepare and prep, but the goal is to look back at a myriad of experiences you've had, whether it's clinical, work, volunteer, military, internship, whatever those experiences are, that you bring those and share those with us. That's how we get to know you. This interview style allows us to assess those critical areas of the job requirements, nursing for all of you, as well as those that are critical to our broader culture of our Stanford organization. So I get questions, will I be asked clinical scenario questions? No, you will not be asked, how do you manage a patient who just had a myocardial infarction? What are the steps to managing a patient who's had a stroke? You will not get clinical scenario questions, but very likely you will get questions about how do you communicate? Because communication is so critical to the role of nursing. Perhaps you'll get questions on how you have functioned as a team player, because teamwork is so critical to the role. Perhaps you'll get questions on how you have interacted with individuals who have different values and beliefs than you have, because you're going to be interacting with patients and colleagues who have different values and beliefs. So they're not going to be clinically related, but they're going to have the values and themes that we're looking for in nursing. The other reason that we use these is because it allows us to be objective. It is a structured interview style that allows us to match candidates, but also compare candidates for the same position by asking very specific job relevant questions. Your questions will always be phrased, tell us about a time, or give me an example. So know that everything we're asking, we want you to tell us about something that has happened in the past. So how do you prepare? So my recommendation, and some of you have heard this before, my recommendation is you do a brainstorming activity with yourself. You sit down and you ask yourself, what are the values of a clinical nurse? What do I know are the qualities of a really strong clinical nurse? This is just some of them. There are a lot of them, but perhaps you're going to say communication is key. Time management, the ability to provide education, compassion and caring, the ability to resolve conflict, teamwork, cultural competency. And you're really going to brainstorm. And then after you brainstorm and you have a large number of qualities, I want you to group those and say which ones are similar. Well, communication also involves delegation, which also involves escalation, which can involve conflict resolution. How do I resolve conflict, by the way, I communicate? So I'm going to put those together. And then compassion and caring and advocacy, those can go together. Teamwork, relationship building, those can go together. And really group some of these themes. And then after you have grouped those themes, I want you to think back to your experiences and ask yourself, when was a time that I performed memorably in terms of communication? When was a time that I had to communicate maybe a challenging message to someone? When was a time that I had to give feedback, receive feedback? When was a time that I had to intervene and de-escalate a situation and use some communication techniques? So ask yourself some questions so you can spark your memory of your experiences. When you think of your experiences, what I want you to remember is we are not scoring your experience. We are scoring and looking and really paying close attention to how you responded to that experience. So for example, if the question is, tell me about a time that you received constructive feedback from a peer or a colleague, and maybe it was during your clinical rotation and you were struggling with giving shift report, and so feedback that you got was you needed to improve your shift report. We're not going to score that story. That is your authentic story. What we're going to look at and review is how you responded to that feedback. What did you do? Did you accept that feedback? Did you say, I agree, thank you so much, and the next day I just went to clinical and everything is better? Or did you sit down and say, I appreciate the feedback. Can you tell me a little bit more? What was it about my handoff? Ask for some recommendations. Maybe you observed other nurses getting handoff. Maybe you went home and practiced. Maybe you made a kind of cheat sheet on paper to help you with your sequence. Perhaps you practiced with your preceptor right before shift report. Maybe you did all of these things. That really shows us how you responded to that situation. That is what we're looking for. So when you go back and look at your experience, don't feel like I have to come with the most amazing story that's just going to wow everyone. Your story is your story. What you want to share is how you have demonstrated these qualities and how you have responded to a challenging situation and what you have done memorably, which sets you apart from the rest. The other thing I want to remind you of is in your story, remember, we are looking at what role did you play? So oftentimes we work with a myriad of people, whether it's in our clinical rotations or work experiences. And sometimes when we interview, we focus on the roles that other people played. The goal of the interview is for us to get to know you. So if your story talks about how your preceptor maybe took over and ran the situation and then you just kind of stepped back, now the story is a lot about your preceptor and less about you. So maybe that's not the best story to demonstrate your qualities and skills. Maybe you want to look at a story that really has you as the center and allows your unique abilities to shine. So after you have done this brainstorming activity and you've put some of these themes in buckets, look at those themes and ask yourself, what questions could they ask me? What questions could they ask me about compassion and caring? Advocacy. Tell me about a time you provide compassionate care. Tell me about a time you had to advocate on behalf of a patient or a family member or a colleague. Maybe teamwork. Tell me about a time that you contributed to a team. Tell me about a time that you were on a team that wasn't functioning effectively. Tell me about a time that you had to give a team member constructive feedback. And write down some of these questions. Throw them in a bucket or a cup. And when you have some free time, pull them out unknowingly and ask yourself those questions, and then speak out loud in front of a mirror or record yourself so you can hear yourself talk. When we hear ourselves talk, we have a better understanding of how other people perceive us. It also allows us to kind of get some of those kinks out, right? Sometimes when we just start answering questions, we might ramble a little bit, or we might get off track. Allowing that to get that out of the way early will help you when you sit down for your interview. It also allows you to practice and feel confident. So when you go into the interview, your anxiety level is a little bit lower, not 100%, but a little bit lower. And when you're able to do that, you're allowing your true self to shine. So people always ask, can you give us some examples of some questions? Certainly. So here are some examples. Tell us about a time when you needed to escalate a situation or concern quickly and efficiently. What was the situation? So that's your story. What action did you take to escalate? That is your response. And then oftentimes you'll be asked, what was the outcome? What happened at the end? It allows for closure of that story. So in this situation, you can talk about any sort of escalation. This could be a work-related escalation. This could be during a clinical situation in which you had to mobilize a situation and get more resources to move something forward. It involves being able to escalate, which is being able to communicate concisely and clearly. Potentially you needed to delegate to others. Potentially you needed more support and had to utilize resources. So you can bring in all those themes in this question. Question 2, tell us about a time you needed to delegate a task to a member of your team. Same thing, the situation is your experience. How did you communicate your needs? Okay, so how did I communicate my needs? Perhaps I stopped them in the hallway. I expressed the urgency of the situation. I said I was concerned. I used a cuss word so they knew the urgency of the situation and why I needed them to go help this patient for whatever reason. Perhaps you then had to delegate to someone else, maybe the charge nurse or a nursing assistant, to check in on another one of your patients. Show how the teamwork was utilized during that situation. So just because the question asks about delegation or escalation doesn't mean you can't bring in these other themes. Well, this is how I communicated. And I also used these resources. That really shows how you responded to that situation. Tell us about a time when your patient's plan of care suddenly changed. So this could be anything. This could be a patient who did not have any pain, who then had pain. This could be a patient who was stable and now is unstable. This could be a patient who was supposed to be discharged and now is not going home, right? So again, the story is your story. So how did you respond? So perhaps you could say, I had a patient, I was taking care of him. He was admitted for post-op, hip replacement. It was post-op day 1. I went into his room. He started complaining about 8 out of 10 chest pain. I realized the urgency of the situation. I asked him some questions regarding the manner of his pain. How did it feel? Did it radiate? I took some vital signs and I immediately pressed the call light to have my preceptor come in. I then communicated with my preceptor the urgency of the situation and what the patient was telling me. I also let her know the last time the patient had pain medicine. I told her what the latest vital signs were, and then we collaborated on some role clarification. I was to stay with the patient, administer oxygen, and then message the nursing assistant to bring me the EKG machine while my preceptor went and notified the physician. When the physician team came, I gave them a very brief SBAR of what was going on, what we had done, and what were the recommendations that I had. That's all about you. Other people were part of that situation, but that's everything about your role in that situation. So feel confident that you've had these experiences. You should be able to speak to all of these in some manner. It's taking the time to think, what did I do during that situation? Some other questions, just so you have some opportunities to practice. Describe a time when a patient, family members, or colleagues' view was different than yours. This potentially would be you were going into maybe give a vaccine during your mother-baby rotation to the newborn baby, and the family members declined or the parents declined. And perhaps your value or your view or belief in vaccines is different than the patient's family, but your role was not to judge. Your role was to provide that safe environment so the family could have a conversation, be educated and well-informed. You provided the risks and benefits. You educated them in a manner that they understood, and you gave them time to discuss privately their decision. When you came back, they still decided to decline the vaccine, but you were able to keep that trusting relationship with them and continue to care successfully for their child and for their mom. So that shows exactly what you did, and it's really all about you. One of the hard things nurses have a hard time doing is talking about themselves. Usually we're pretty modest and humble when it comes to that. So this is your opportunity really to take a minute and say, I need to talk about me and tell this panel everything about me, because that's the only way we're going to learn about you. Again, we talked about constructive feedback. Tell us about a time you advocated for a patient. So remember, as you're answering one theme, you can bring in other themes. One of the things I tell people is when you hear a question, you might want to say, I wonder what they're really asking. It's not necessarily trick, but tell us about a time you received constructive feedback. So maybe this is my ability to learn and to grow. Perhaps they want to see, how do I communicate with my peers? Perhaps they want to see, how do I contribute to the team? Am I someone who can change a behavior? Am I someone who can learn as I go? Ask yourself, what do I think they're asking? So then I answer what they're asking, right? Tell us about a time when a patient's or family member's view was different than yours. Really looking at, how do you maintain relationships even if people see things differently than you? How do you communicate? What's the style in which you communicate to keep that relationship? So ask yourself or prompt yourself, what do I think they're asking? So then I can make sure that I'm answering it in the way that they're asking. So during a behavioral interview, listen to the question fully. It's mainly 3 parts. First is, tell us about the time, you, and then it's the quality that we're looking for, right? Communicated, we're on a team, etc. And then what happened? How did you respond? And what was the outcome? Normally, that is what you'll hear. Feel free to write down the question if that serves as a prompter for you to be able to make sure you hit every question that they ask. If you don't understand the question, if you misheard the question, ask. Can you repeat? Don't answer the question unless you fully understand. We talked about the components. Feel free to use experiences, examples from all of your experiences. You've had a lot: clinical, internship, externship, work, volunteer, life, etc. The one thing I'm going to guide you is to remember that you're interviewing for the role of a registered nurse. So let's say you are a respiratory therapist or a nursing assistant or a pharmacy tech in your current role. But all your answers, you're telling me about in a time that I was a respiratory therapist. This time, and every question we ask is all about being a respiratory therapist. Sometimes it's difficult to see how you may transition into the role of a clinical nurse. So I welcome you to use your clinical rotation or your clinical nursing experience in addition to all of those other experiences, and not just solely pick, I'm just going to talk about my work experience, or I'm just going to talk about this one clinical experience I've had. Share all of it so we really get a full understanding of who you are. Bring your best self. Virtual interviews, it's a little bit harder to connect human to human, but it's not, but you can, and we've seen it. So try to limit any distractions, position yourself in a quiet place, wherever that may be. And then position yourself so we can see you, right? Don't be too far away from the camera where we can't really see you. Check your lighting so we can really see your face. Try to connect with your audience. Show that personality, engage, nod, smile, show who you are. I often say to people, it's a little bit like being on a blind date. So if you show up on a blind date, very serious, good morning, my name is Kerry Zoss. I'm very excited to be here today and interview with Stanford Health Care. I went to the University of San Francisco. I did my clinical rotation at San Francisco General, and my goal is to work in the surgical area. Likely, I'm probably not going to get the call, right, that I'm looking for. But if I come and bring who I am, good morning, my name is Kerry Zoss. Really excited to be interviewing for the surgical panel at Stanford today. I'm a graduate of USF, go Dons. I did my senior preceptorship at San Francisco General Hospital, and it is just a real honor to be with all of you today. Now you get a feeling of who I am. The reason that's so important is that is what you will do every job, every day as a nurse. It's all about the human-to-human connection. So the managers want to see it. Anxiety and nervousness plays a role. We know that. Some people stumble and go, I'm sorry, I'm really nervous. Good, tell us that. Take a breath and reset. That helps us, right? It allows us really to get to know you. We're going to teach you all of the Stanford way on managing these Stanford patients, but we can't teach you how to be you. So we need to be able to see that in some way. So showcase that personality. During the interview, you will hear other candidates' answers. And you might go, oh, I didn't have that experience. That's okay. We're not hiring everybody with the same experience. The goal is we want a diverse and dynamic workforce that looks like the patients and it acts like the patients that we take care of, right? Which is very diverse and dynamic. So we want all of you to be different. So that's okay. If you haven't had the experience or the opportunity as another colleague, maybe you weren't in an ICU for your clinical rotation, that's okay. That's not the expectation. So listen to and respectfully listen to the other candidates, but don't feel like because somebody else has a different experience, I may not be as well prepared for this interview. Not at all. Stick to your experiences. Don't be swayed by another candidate's answers. Bring your authentic self. The other thing is, sometimes people don't answer the question correctly. And when we listen to other people answer the question, then we go, oh, is that how I'm supposed to answer it? And then all of you answered exactly the same. So listen for yourself. Listen to the words. What are they asking me? And then you answer. Even if Bob, who answered before you, answered completely differently, you need to stick to say, this is what I feel like is the correct answer. And lastly, guys, do not write down your answers, please, and read them. We have seen that in a virtual interview, that candidates on some wall somewhere have all of these different experience and they're reading. And you can tell when people are reading because they're looking like this. And they're so articulate. It's really hard to be articulate in an interview because you're supposed to be nervous. The reason you don't want to read is twofold. One, we can't see your personality. And number two, nothing about nursing is scripted. You are never given the opportunity before you go into a room to write down exactly what you're going to say to the patient, how they're going to respond, and what your response is going to be. Nursing is 100% unscripted. So if you can get through an interview unscripted, that is already setting you apart. So even though you want to have all of that stuff in front of you to help you, put it aside and just come and bring your genuine self. Okay. There has been a shift with COVID with a lot of things. We used to do in-person and now we do virtual. Virtual is not so bad. You can still show who you are. You can engage, you can nod, you can smile. We've had laughter. Again, don't let other people's answers minimize your answers. Be proud of your story. And the thing you want to remember, it's 50% about what you say and also 50% about how you say it. So have the energy, have the enthusiasm, have the excitement, allow that to shine and show, because it's also about how am I communicating what I'm saying. If you feel like I am so anxious, oh my God, the interview's about to start, there's Kerry's face, what am I gonna do? I want you to remember this. This is what I say to all the new grads. An interview is a conversation. We're just talking to you. We're just trying to get to know you. I'm going to try to get to know Nicole. I'm going to try to get to know Christina. I'm going to try to get to know Justin a little bit better. And we're going to do it by asking you a series of questions. What makes it so intimidating is the outcome, right? It's like, I got to do this because I'm banking on this outcome, or I really want this outcome. But at the end of the day, it's a conversation. So if nothing else, when you come to that interview or any interview that you're doing, say to yourself, I'm just having a conversation with another person who's trying to get to know me a little bit better. Okay, Carly, were there any specific questions about virtual interviewing, or do we want to wait to the end?
The only one that I'm getting repeatedly, so I think it might be best just to answer it really quick. You were only able to interview for one area. The area that you were invited to interview for will be the only unit you can interview for at this time. But outside of that, I think we can wait till the end, Kerry.
Okay, perfect. Thank you. So just a little bit of information and we'll move through this. We won't spend a ton of time. We'll talk about the nurse residency program for those of you who may not be so familiar with the nurse residency program. So the Stanford Health Care Nurse Residency Program is an accredited program, a nationally accredited program through the American Nurses Credentialing Center. So our program is designed to bring in newly graduated nurses, which is all of you, with less than 6 months of clinical RN experience, and really provide a transition to practice program. So taking you at this advanced beginner level, which you all are, because you're not novices, you're advanced beginners, you have education, knowledge, and experience as nurses, and really transition you into this clinician between 1 and 1.5 years is when we really see that competency. The goal of our program is really to support you through, and it kind of depends on your specialty, but a really robust orientation program with a dedicated preceptor, around 300 to 400 hours of orientation, and then supplemental education and training through my team in the nurse residency program, as well as immersive simulation activities with that my team support. And then in addition to that, create a structure where you can really be successful. So we know Stanford's a really big place. We don't want you to get lost in the shuffle. So really create a support system in which you feel supported, not just at the beginning, but throughout that whole 1-year residency program, not just by our team, but by your unit leadership team, and your unit peers. So we are a Vizient nurse residency program. That is the curriculum that we follow. So what does that mean? So not a long time ago, but essentially when I graduated from nursing school, nurses were not staying in the clinical environment a full year. So there was a lot of attrition. People were leaving. And so academic medical centers got together with schools of nursing and they said, how do we support individuals in that first year of clinical practice? And they created these nurse residency programs. And that is what they're designed to do. The goal is not that we reteach you what you learned in nursing school. You have done that. I have done that. We're going to put that aside and we're going to move forward. The goal is to saying, this is what you learned in nurse residency school, Jacqueline. How can you apply it at the bedside at Stanford? And that's where we help with that transition to practice. Sometimes it looks a little different, or we need a little bit support of what does managing a patient with sepsis really, really look like? What are my resources? What are my tools? What are my support staff? What are my workflow? What are the nurse-driven interventions at Stanford that I can implement to manage these patients? What does that look like? And support that rather than what is sepsis? So it's taking what you already know and focusing on the application. We focus on 3 domains: leadership, which is really about coordinating care for that patient, managing conflict, communication, all of the escalation, delegation, managing of resources. The patient outcome, which is a huge part of that clinical reasoning. So I prevent failure to rescue for that patient. Education, managing pain, really managing that changing patient condition. The patients at Stanford are incredibly sick, very, very high acuity. So we spend a lot of time saying, how can you identify that my patient has a problem and move it forward before that patient has an unanticipated outcome? And then looking at the professional role of all of you. How can we grow you to where you want to be, not just in that 1 year, but beyond that? How do we give you tools so you can manage stress, take care of yourself? Resiliency is something that we really had to lean into in the last couple of years. And then talking about some of those more challenging topics, right? What does it look like to manage patients who are at end of life? What does it look like to have ethical decision-making? How do I provide really cultural, competent care? And then giving you an opportunity to go into your practice and say, I wonder if I could do something different, and go into the literature and say, what is the literature? What is the best evidence? Really igniting that passion for inquiry. And we do that through your clinical orientation with your preceptor, through all of your seminars and simulation, through giving you time and clinical experts to lead your evidence-based project. And then we create a sequence of meetings throughout that 1 year with all the key players, your managers, your preceptors, myself, your educators, who really support you in that first year, really allowing you, really creating that schedule so you can be successful. So our program is growing, as most of you know. We're going down to 2 cohorts a year, but the numbers are staying the same. So we're looking between probably 180 to 200 for our fiscal year 2022. And we're super excited that our retention, especially for our area, is still hitting the mark. So excited to see this program keep growing and our retention to keep moving forward. With the volume also becomes the areas in which we're hiring. So we are hiring into all of our inpatient areas, ICU, oncology, all of our inpatient medicine, inpatient surgery, inpatient float pool, inpatient psychiatry, which is both the voluntary and involuntary, the interventional platform, which is that peri-anesthesia area, so pre-op and PACU. It is considered one department, so you are trained in both and you will work in both. You're not going to be hired just in pre-op or hired just in PACU. And then our clinical trials area of nursing research, which is where Aimee, who's on this call, works, which is a direct patient care position. You are managing and taking care of patients at the bedside. The extra with this is you are trained to take care of patients who are undergoing complex clinical trials at Stanford. So perhaps there is an oncology patient who is going to be given a new chemo drug, and you are going to manage that oncology patient. You will be the nurse for that patient, and you will be administering and providing care for that clinical trial. And we see that throughout all of our inpatient areas. So, we are not in October. I'm sorry. I thought I moved that forward. We are in January. So this is our timeline for cohort 36. We are very close to our panel interviews at the end of this month and still reaching out to candidates to secure those positions. And then our cohort will start March 21st. So if you are not in a position or you did not apply to the spring cohort, or perhaps you didn't get an interview for the spring cohort, never fear. Cohort 37 is going to kick off in April. That's when our application is going to open. And then our cohort will start at the end of August, August 22nd. Still planning on hiring into all of those areas. And as always, we'll do an application preparation session before that application opens and marketing, so you have an idea of what areas we're offering positions into. So I've done a lot of talking. I want to turn it over to all of you on the call. Again, Leslie and Aimee and Daniel are joining us today. I welcome all of you to come on video so we can see you. And please feel free to answer any questions for any of them, myself or Carly.
I have a quick question, actually. From looking at other residency programs, I was noticing some of them have contracts and some of them don't. Does this program have a contract for the residency?
No, we do not have a contract. We ask for a one-year commitment with no break in service, but there's no contract tied to that.
Is it 1 year for the residency, or is it residency and then 1 year?
1 year from your start. So from March 21st. Other questions?
Yeah, I have one question. How we can fill the application for this program?
So the application for the March program has closed. Our application for the August program will open in April.
Okay.
You can visit, there's no application right now. So if you visit our career website, there's no active application. But when it opens on April, I think it's April 18th, you will see the application there, and it is through an electronic system, and that is how you can apply. And we leave it open for 2 weeks. So you can apply anytime during that 2-week time period.
Okay, thank you. Thank you so much.
I have a question for the 6 months of experience. Is there any like exclusion? Is it just hospital setting, or is it any RN position?
Any clinical nurse position. So if you have 6 months or more RN experience, you are not considered a clinical nurse 1. You are considered a clinical nurse 2 and can apply to any open clinical nurse 2 position at Stanford that are on the current website or the job board. In terms of residency programs, in order to be a residency program, you have to hire newly graduated nurses, usually with no RN experience, but we realized that's really, really hard. And so when we spoke with Vizient, they said less than 6 months. So it's less than 6 months in order to be considered truly a residency program.
Thank you.
With that being said, so it's kind of expected that some of us won't have previous experience. What will make us stand out that since if we don't have previous work experience?
So that's okay if you don't have previous work experience. That is not a requirement for the job. Managers all are looking for unique individuals. I will say that a lot of experiences or jobs that you've had, they may not be in healthcare, but the qualities or the characteristics of those job roles you need in healthcare. So people who are in the service industry, whether you work in a restaurant or you work at Starbucks or you work at Nordstrom's, where you have to interact with customers, you have a skill set that is very, very similar to what you will have to do at the bedside, because you will be interacting essentially with a customer, just in a very different form, but really on how you communicate, essentially on how you deliver information, how you take people who are maybe not in the best shape or feeling very anxious and really try to kind of bring them where they need to be. So I think leverage any experiences that you have, even if it's not healthcare, right? Like there's so many different experiences. Some of the greatest nurses that I have ever worked with never had experience in healthcare before, but they had all of these experiences when they had to work with a dynamic group of individuals, and that made them really shine. So I think look at your volunteer or internship or work or life. If you're a parent, that's dealing with a whole group of unique individuals right there. If you have a bunch of kids running around, right? Coming from a big family, whatever that looks like, you can leverage all of that. So don't think that one sets one apart. Does that make sense?
Yes, thank you.
I actually have 2 more questions. The first one, because I was reading a lot of the chats and someone mentioned about your NCLEX and when you get your results and how that changes your application, like timing wise, because I know in the last year or so, a lot of people were getting pushed back to take their NCLEX because of COVID and whatnot. So for example, I graduate in May, so I'm applying in April. What is the time period for I need you to have passed versus all I need is the test date that you're taking it?
So we will, I don't have the exact date for the August program. Mm-hmm. Essentially, you need to have your RN license. Carly, do you know?
To be safe, I would say 30 days prior to the start date. Generally, we're trying to do 6 weeks prior to the start date, just because there have been delays 3 to 4 weeks between taking the test and getting the official license.
Okay. But you can totally apply without your RN license.
Okay, cool. And then my second question is for Stanford, what is the pay rate for nurse residents?
Is it 72 something?
72.54, I believe. And then you also have full benefits. So, you know, within a month of starting, you'll have full medical, dental, vision, PTO, all of that. So it's it's not just like an internship type program. You will be a full-time employee of Stanford.
Okay, awesome. Thank you.
Hi, Kerry, and the team for hosting this. This is very helpful. I need to hear a lot of the things you were saying. I actually had a question about the interview. In the application process, we've had to answer a lot of essay questions regarding, you know, how a time where we provided compassionate care, things like that. So in the interview, should we reinforce on those examples that we provided within our application, or should we be prepared to bring a brand new set of experience that we have under our belt as examples?
It's really up to you. I always recommend people try to bring more information. So all of those hiring managers have your application. They have everything that you submitted in Workday, they have access to. So they can read that example. And if you shared the same example, it's okay. It's not, you can't use that, but perhaps you're like, I want to build on that and share some more. So they get to know me a little bit better.
Okay, thank you.
I am going to ask our nurse residents on the phone or on the call if they wouldn't mind sharing how they prepared for their panel interview. Aimee, I'm gonna put you on the spot if you wouldn't mind sharing with the group what you did to prepare so you were successful.
Sure. Hi, everyone. Welcome to our prep session. We are so happy that you're actually here, and we look forward to meeting some of you future nurse residents on the floor. Ways in which I prepared is I actually joined two of these prep sessions prior to me actually interviewing. I attended, I wrote down the questions, I practiced a lot of the tips that Kerry shared with us. So a lot of the information that she's sharing, I actually used, and the tips I used in my interview sessions. Something else that I did is I got together with a couple of my cohort people from my nursing program, and we practiced together. I did some Zoom meetings with them. I recorded the Zoom meetings because I wanted to see how I reacted, how my facial reactions were, what I said, how I said it, how I came across. I even looked to see how the lighting in the room behind me would be, everything like that. So I used those different tips. It's a little hard and it's a little awkward to record yourself, but trust me, you are going to be so glad that you did, because it tells you a lot of things about how you present that you don't actually even realize. I also used the STAR method. And like Kerry said, I made sure that I wrapped up. Please don't forget the outcome. And if you learned something about that situation, make sure that you say that too. Say that you learned something either about yourself, something new, something out of the situation itself. Make sure that you tell them that, because they want to see that you're actually learning, that you're being observant, that you aren't afraid to admit that, hey, you know what, maybe I didn't know in the beginning, but I do know now. So use examples like that as well. I don't want to say everything so that others in my cohort could actually pitch in and give you some of the tips that you did, because I feel like we probably all used a lot of the same tips. So if one of my other cohort partners wants to go ahead and jump in.
Leslie, you want to jump in?
Hey guys, my name is Leslie. Like Kerry said, I work on the K4 surgical trauma liver transplant unit. So like Aimee, I did these Zoom sessions as well, wrote down a lot of the notes as well. And then I had a lot of time with family members, cohort mates that I went to school with, and we would sit down and kind of brainstorm throughout our clinicals, different situations that I had or things that I learned from, and I wrote those all down. So I have a notebook that I brainstormed for several weeks when I found out that I had an interview, and even before that when I was applying to residency programs, just kind of trying to brainstorm different situations that I was in that I could potentially use for interview questions, because a lot of people are using behavioral style interviews now too. So I would write down notes, and like Kerry said, very specific that the managers are looking for, that you set the problem or the situation, what the patient's condition was or whatnot, what you did, and then the resolution or the outcome. Definitely don't forget the outcome. Like Aimee said, you want to make sure that you wrap up the full question and answer all of the questions, or the questions within the question, because there are multiple facets of it. And like Kerry said, you can always have them repeat. There's no points taken off for that. You are human, and we are all nervous. It was kind of like Kerry said, it was nerve-wracking, but it's just human conversations, and just try to be level-headed about it. So kind of the same way. I did record myself a few times, but for the most part, I tried to do it with other humans, my parents, sisters, friends, that kind of thing, so you could see how your body language was. And I also timed myself. The interviewers, the managers will ask you to try and limit your questions to about 2 minutes, or your answers to about 2 minutes. I know that doesn't seem like a lot of time, but when you have several other people on the interviews, it can get very long. So try and be pretty direct as to what your story is, to try not to ramble too much. I think that's about really it as far as the interview prep.
Thanks,
So,
Leslie.
yeah.
Daniel, anything to offer?
Yeah, again, my name is Daniel. I work at E3 Oncology, and I think the two of my cohort members have said everything that needs to be said, honestly, and maybe some things that I could add. Or, I did a lot of the brainstorming that Kerry mentioned. I did, and I think when I was at school, some of our clinical instructors asked us to write journals after our sessions, and I found some of those and looked back on some of the patients that I've had, and really highlighted some of the things that I remembered about them or were significant about them. And I think Aimee mentioned this, but using the situation action result method during the interviews really helped me keep my answers succinct and to the point, because, I timed myself before the interview and I felt like I was talking a lot or going multiple different places in my answers. But, following that situation action result and then coming back, and the result part to the situation, how that situation got resolved, or, what did you learn from it? I think that's really important to make sure you highlight, what you started with and what you ended with, and connecting them together. And it's almost like a story that you're weaving, and you're starting with, the beginning, and then you're tying it all at the end. And, I think practice, obviously, I think Leslie and Aimee both mentioned it, practicing with other family members, practicing with friends. I actually had the chance to interview at, I think, 2 other hospitals before Stanford in the Bay Area, and they asked similar behavioral style questions. I'm like, oh, it's great practice for me to interview with them and be able to come and interview at Stanford. So yeah, it's really helpful to practice and record yourself and take notes and brainstorm and stuff. And yeah, again, during the virtual interview portion, I think Kerry mentioned this already. While others are giving their answers, make sure you look engaged, smile, laugh at their jokes. I think the managers are really looking for that too, is, how do they react to other people's story and how do they relate with others? And it's hard to do that because you're not face to face, but it's also evident on Zoom if you're respecting others and their answers and really listen to what they have to say as well.
Thank you. I saw a couple questions in the chat. So we don't time you, because that's just another layer of stress that nobody needs, right? However, I recommend thinking I should be around 2 minutes. No one is going to time you. If you are hitting like the 4 or 5 minute, we're gonna let you finish, and then we'll say very kindly, Fitz, just a reminder, we're gonna ask you to keep your questions to about 2 minutes. You're gonna be like, okay, because we know nerves play into that, right? So there's not gonna be a stopwatch. But that's why you practice, because we ramble by nature when we're nervous. I think that's just like that fight or flight response. Like, how do I get out of this situation? And then you just start rambling. So that's why you practice. And the goal of putting random questions into a bowl or a bucket or whatever is that's the element of surprise. If you know exactly what question I'm going to ask, there's no surprise. It doesn't make you think on your feet. But throw 10 random questions into a bowl and pick one, there's an element of surprise and you need to kind of mobilize. You can absolutely write the questions down. That's totally fine. You will hear the same question multiple times because your peers will get that. So we limit the element of surprise with that as well. Other questions for our residents? And you can ask about their transition as well. Yes, Carla.
Hi, Ms. Zoss. I actually have a question regarding your union. I saw that you guys mentioned that you guys were part of a union. Now, as a new grad, are you automatically in the union as soon as you get hired?
Yes, you can participate in the union. Yes.
Thank you.
I have a question.
Go ahead, Veronica.
Oh, I'm sorry. Yeah, so my name is Veronica. I actually have a question regarding the interview process. I know, like you said, Kerry, sometimes during interviews, we get very nervous and might miss a part of the question or might not answer it fully. If that does happen, will the panel ask for clarification, or is it kind of like, oh, your answer is your answer?
So if you're answering a question and they ask for the outcome and you didn't provide the outcome, they will say, Veronica, do you mind sharing the outcome? Because likely you probably just forgot that was the last part of the question. But if we ask about a question where you receive feedback and you are talking about a totally different situation, they're going to let you just go with that answer. Does that make sense? So they'll prompt you, maybe if there's just an element of the question that they just want to remind you to answer, but not a ton of clarification.
Okay. Thank you.
Hi, thank you again for having the Zoom information session. My question is, do you think it's distracting during the interview to type up the questions and have like a little post-it in the corner where I'm able to look and see the question in front of me, as opposed to like writing it on a piece of paper and looking over here to the side, or
whatever works for you.
Okay.
Yeah, I think if they're asking you the question directly, and all of a sudden they hear like tick, 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 maybe not, maybe hold off on that. But if they're asking your cohort or your candidate mate and it's not your turn to answer, yeah, I think you can write that down. Whatever way that you feel will help you, go for it.
Okay, thank you.
Hi, I had a question for anyone, for either Kerry or the people in the nurse residency program. So are there any specific characteristics of an applicant that would make them more suitable for a particular type of unit? And yeah, you could just discuss based off of which unit you're on.
Okay, Leslie, what are the characteristics of a really great ICU nurse? Go.
We're very anal and OCD. There's a lot of things happening. And our ratios, I know I saw a question in the chat, our ratios for all ICUs at Stanford and I think in California is 2-to-1 or 1-to-1 if they're on like CRRT or any specialized equipment, anything like that that makes them like super complex where they're super busy or critical patients. Yeah, we like a lot of things happening at once. You got to kind of think on your feet and be able to jump between 2 different rooms. Yeah, well, a lot of different critical things happening. For me personally, I was a 911 EMT before becoming a nurse. So I had a little bit of experience in trauma and critical situations. So I knew going into nursing that I wanted to be a trauma ICU nurse. So very fortunate to have landed where I landed. So our floor, like I said, it's surgical, trauma, transplant, liver transplant. So we do get a wide variety of head trauma, normal traumas, and then surgical issues. So any surgical complex patient, we can get sometimes expectant mothers that have had a complication during C-sections, that had a massive bleed. They come to our floor as well. And then we do all liver transplants. So we sometimes get the pre-donation liver patients, and then we also get the post-op liver transplant patients. So just pretty much kind of thinking on your feet, being fast, noticing quick changes in patient care, that kind of thing.
Thank you, Leslie.
Daniel, qualities of an oncology nurse.
Yeah, I've actually talked to my manager about this and asked her, what she looks at new grads or new applicants. And I think she told me that she really values compassion. I think as an oncology nurse, you really have to deal with a lot of, sick patients that probably don't have a long time to live. And, having that compassion and care for those patients is really important, and what, my unit values. And, also the ability to kind of learn and adapt to changes. I think Kerry already mentioned there's already a lot of new chemo coming out or new treatments. And, even in nursing school, when I was in nursing school, we didn't really talk about cancer too much or chemo too much. So it's not like, I didn't have that base of knowledge. It's not like a cardiac patient, what to do, or, shortness of breath or COPD, you learn about that in nursing school. But chemo and cancer is something that at least in my class, we didn't really talk about it too much. So the ability to learn and adapt, and also the importance of having compassion towards your patients. I think the behavioral questions are designed to highlight and show that, your compassion and your advocate for your patients, and the fact that you can learn and think quick on your feet, like Leslie mentioned. So all of those characteristics are, something that an oncology nurse should have.
Aimee, clinical trials.
I would say for clinical trials, nurses that like to research stuff, like to pay attention to details, that like to ask questions. Also nurses, like the other floors, that show compassion. Because remember, if a patient is going through a clinical trial, oftentimes it's a last resort type of clinical trials. You go to the oncology units, you go to the COVID units, you go to the neuroscience units. So these are all patients, that are willing to give up their body and their self sometimes, you know, they're at the end of life and this is their last ditch effort to try and survive a little bit longer. So compassion, empathy, being able to communicate with that patient and not be afraid to communicate with them, not being afraid to communicate with their family members that are also feeling that anxiety, that stress, that fear. Somebody that's just willing to put themselves out there. You have to be flexible. You could be on one floor one moment and the next day you're going to be on a completely different floor doing a completely different clinical trial. So be able to be flexible. Ask a lot of questions. If you don't understand something, make sure you ask, whether it's to management, other nurses. We lean on each other a lot in this department, and we'll go over different clinical trials and say, hey, what is your take on this clinical trial? What's the best way to approach this? All right, let's go in there, let's do this. So make sure that you're the type of person that is able to be flexible. That's pretty much it.
I have a question specifically for Daniel as far as the timeline with ONS certification. Does the residency program, the 12-month program, get you to the point where you are able to sit for that test, or is it another additional year beyond that?
So, that's a great question. So basically, I've talked to my manager about this, and I'm at my 6-month mark, so I'm a CN2 now. And I think during the first 6 months, they really have you focus on making a foundation or a baseline for your nursing career. So I don't really focus on giving chemo or doing a lot of chemo yet. But I think once I hit that maybe 7-8 month mark where I feel comfortable with managing more of the medical surgical patients, my manager wants me to take classes and become chemo certified. So the first step in getting your OCN or chemo certification is to get chemo certified on the unit and give chemo for a certain number of hours. And once you've given chemo for a certain number of hours, you can sit for the exam and become, get that OCN certification. So again, it's, the first 6 to 8 months is just getting a foot in the door and getting a kind of an understanding of how to be a clinical nurse. And then after that, you can get signed off on chemo, start giving chemo and managing chemo.
Got it. Thank you.
Hey, if it's okay, I have a question for Daniel as well. But first, thank you, Kerry, and everyone that has been here to help support us in being successful in our interview. Daniel, I was just curious if you could kind of share your journey as the new grad at Stanford, what that looks like, what your struggles were just starting. I'd really just like to hear about the support and foundation that you received from Stanford to be successful in where you are now.
Yeah, I think my journey so far, has been really good. 6 months has gone by so fast, and I just feel like 6 months ago I was a new grad nurse working for the first time, and passing meds and stuff like that under my own license, and it was kind of nerve-wracking because you feel like you might make a mistake or you might do something wrong. But I think the preceptors that I had in my unit and the support from Kerry and the NPDSs on my unit, there's people that follow you and make sure you're doing okay, reach out to you every couple of weeks to do check-ins. And I think that really helped me, and really brainstorming ideas of how I can get better with those people has helped me progress as a new grad. So in the beginning, yes, it was a little challenging and daunting, but I think over time, having the ability to check in with people that are a lot more experienced than me and having preceptors that I can rely on really helped me develop that foundation to be a stable and safe, independent nurse. And I think, even now when I'm on my own, there's a lot of support on the unit. And I think because the new grad program has been going on for so long, people are used to having new grads around. And, at first I was like, oh, what if they don't like me, or what if they don't answer my questions or don't help me? But I just feel like, they're experienced nurses who have been new grads in my unit for a couple of years, and they knew what it was like to be in the position that I'm in. And I think having the ability to reach out to them and ask them questions has really helped me progress as a new grad. And one of the most challenging things in the beginning for me was, being confident in my skills and being confident in the fact that I can practice safe nursing. And I think I'm still at that point where I'm learning how to be confident and assert, kind of my knowledge base that I've already had and experience I've already had. And obviously you're going to make mistakes. I've realized that in 6 months I've, made a couple of mistakes, but, learning from those mistakes and making sure you grow, I think that's really helped me. And not being nervous, stepping in, asking questions when you don't know stuff. And even if a patient's really sick or really severe, just having that understanding that I've trained, years to be at this point, and I've trained for years to be where I'm at. And, I can do this, right? And if I don't know something, I know there's a charge nurse or a float nurse or another nurse that I can call into this room to help me right away. Or, even the doctor, I can text them on the Volt and say, hey, I don't really understand this. Could you come explain this to me, or could you come to the bedside? So I think, in the beginning, the challenge was being nervous and scared, but over time I've learned that it's okay to be nervous. It's okay to be scared, but it's also important to be confident because of the training you've had and because of the support you have on the unit.
Thank you. I have one question for Leslie. Hi, Leslie, for your ICU in your unit, can you just elaborate on how you feel the culture is in your unit for the ICU? I think culture is so important. So for me, I like ICU, so I just want to know what your culture is like in the ICU.
Sure, absolutely. So just kind of like Daniel and Aimee, this program is very designed to make sure that we thrive, becoming, confident nurses. So Stanford having this program, all the units know there's new grads around every couple months. There's new ones. The preceptors are specifically trained to be preceptors to train us. So the culture overall is very positive. My unit specifically is really great. I work night shift, so my night shift crew they're all very great. I have several preceptors that I've worked with and very supportive. Just like Daniel, if ever I have questions, which is a million times a shift, even now still, every patient that I get is something new I haven't had before. And even if it's similar, there's always questions. In the ICU, our beds and the layouts look a little bit different than the medical surgical units. So it's kind of very open and there's a lot of glass and stuff. So you just kind of pop your head out and somebody like, what you need? So everyone's really supportive. Everyone walks by, your float nurses, how are you doing? Do you need any help? So overall experience is very, very positive. Everyone's been really great. And just like Daniel said, everyone was a new grad at one point. And many of them in the ICU were new grads in the ICU. A lot of them actually at Stanford too. So they know what it's like, and the stress. I mean, every shift, there's a little bit of anxiety and stress still going into it, not knowing what you're going to get. And, the ICU, there's pretty critical patients up there. So you just kind of have to go into it knowing you have support. And if ever you have a question, my motto through nursing school was, if I ever don't know something, I'm not going to do it, because it could be dangerous or you could do some harm that you don't want to do. So I always ask a million questions, and until you've seen something so many times and know, okay, this is that central lines and all that medication administration in the ICU. There's a lot of medications that can't go through peripheral IVs and they have to go through central lines. So making sure that you're looking at your MAR and making sure that you're tracing your lines, because sometimes you can have up to 15, 16 drips or more, and all the lines look very similar. Making sure everything's labeled. So being safe is huge. Like Daniel said, making sure you're being confident in what you do know, and also being humble in what you don't know. So just always asking questions. So that's kind of been my experience overall. Very, very positive. Our cohort and our floor is really great. All the ICUs are great.
Thank you. I appreciate that.
I had a couple of questions as well. So what is the etiquette on a panel interview? If we're all having a conversation, is it okay to respond to another applicant's answer? And then also, what are the common missteps, or what kind of gets candidates weeded out? What are like the don'ts of going through this process?
Do the residents want to say any mishaps?
I don't know about mishaps, but I do know during your interviews, I would definitely try to engage. So I know when you're on Zoom calls, I graduated in December 2020, so I did about 9 months of online nursing. I know the Zoom calls can get long and listening to people can get very long, but part of the behavioral interviewing and managers seeing your presentation is being engaged. I know it's been kind of repeated, but and I did see a question somewhere in the chat that someone said, well, I have a very similar experience. And what if that was the answer I was going to use? That's totally okay. Everyone is individual and has your own experience. And even if it's so similar, say, hey, I had a similar experience to Laura. This is how mine differed, and this is how it was similar, and tie it into that, because that shows the managers you were actually listening to your other, the candidates' answers. And that's really important, because it shows that you can be engaged and they see how how you're listening. So that's a huge part of it too. So I would try to be engaged. You don't have to tie all of your answers in, but for me personally, I know in my first round of my interviews, the panel interviews, I did tie in one, and actually I think the second one I did too. So because those are potential, when you get to the floor level, those people, if you do get hired, those potentially be your cohort mates on your floor, which is true today. So just trying to show that you can interact and be personable with your cohort mates shows the kind of person that they want to hire you. So I would just stay away from any negative talk or anything like that towards any of your other cohort mates or past nursing school mates, but overall positive things to try and tie into.
Hi, this is Aimee. I couldn't agree more with Leslie. I actually did tie in one of my answers to one of the other candidates as well, but be careful not to interrupt that candidate. So if the candidate is still talking or if they have just completed, I wouldn't tag onto it at that time. I would wait until it was my turn because I'm going to get the exact same question that candidate got. So they're going to rotate to you. So once it came to me answering that question was when I mentioned, oh, I had a similar experience to so-and-so, and this is how my experience was. And make sure that you're smiling during the interview, because even though you may not be answering any of the question at the moment, they're still looking at you. You're still on camera. They're still observing your personality. That's the only opportunity that you have to let them know what your personality is like. So in those moments where you don't think that someone's eyes are on you, they actually are. They're paying attention to what you're doing and how you're doing it. So if the other candidate is, responding, if you're in agreement, nod your head, smile, they make a joke, laugh. Don't disagree. Don't shake your head like, no, that did not happen, or no, that's not a good, response kind of thing. Just stay positive, like Leslie said, and you're going to do all right.
I think a couple more things to add. As I mentioned, don't read your answers, right? You want to have that unscripted response. I also think you always want to paint yourself in a good position. So sometimes there's questions about, tell me a time you made an error. We all make mistakes. I think it's knowing how that error is going to be perceived. So for example, if you said, I had a med error, I gave a half dose or a full dose instead of a half dose, okay? Or I made a med error, I didn't scan any of my meds. I just went and gave all my meds, I didn't scan. That's going to give someone a little bit of a pause, right? So there's human error, right? And things happen, but then there's some intentional, like you didn't really follow the process. That may give someone a little bit of concern. So I think when you share things, challenges or error, or times you made mistakes, think about those a little bit, because you don't want to give that hiring manager pause to be like, ooh, I'm concerned that this person would make a similar mistake because they didn't follow the process. So I think that's one bit of feedback I would have.
This is Justin. I had a question for Leslie, if you don't mind. When you first started off, were you with a preceptor on a daily basis caring for patients, or did you just have like the ability to reach out to a preceptor, or how did that work?
Yeah, very good question. So from the very beginning, especially in the ICU, especially the very beginning. So what happens is my floor specifically, our managers hire all of us full-time for night shift. But with that being said, depends on how many people get hired and the availability of preceptors. They like us to see both day shift and night shift because they're both very different shifts. A lot of things happen on day shift that doesn't happen on night shift. So for the first 4 weeks, you're always with a preceptor, especially with anyone in the first 6 months. The AAU units, their preceptorship is a little bit shorter than ours. Ours is like, carries it like 8 more weeks or something like that. Mm-hmm. Yeah. But anyway, yeah, you're always with the preceptor. So my day shift preceptor, I was with her for 4 weeks, and then I transitioned to night for 4 weeks with my night shift preceptor, flipped back to days, back to nights, and then I was permanently on nights. So about 2 months ago, I came off of preceptorship. I've been on mentorship, which just means I transitioned from not having my preceptorship or my preceptor linked to my hip. So normally when you're on preceptorship, you're one-to-one with your preceptor. So you have either 1 or 2 patients and your preceptor's always right there with you, reviewing your charting, giving you help, guiding you, kind of, like what I would do is that, I would, at the beginning of the shift, I would say, okay, well, this patient's a little bit more unstable. This one's not. I'm going to do this, and kind of go through your plan of thought with them. The further along you get, the more the leash gets a little bit longer in the ICU. So they let you work a little bit more independently. But now being on mentorship, I'll finish that in about a couple weeks. I have my own assignments. I have my own patients, but my preceptor is just kind of around. They're usually our float nurse. So if I need anything, I'm comfortable with her, but obviously all the people on my floor, a lot of them are mentors and preceptors as well too. So a short answer, long-winded, yes, you will be a preceptor for at least your first 4 months if you're in the AAU or the ICU, and then you kind of transition to having your own assignments. So.
Okay, cool. Thank you.
Hey folks, my name's Ari. I have a quick question for the current residents. Just curious what kind of structure exists regarding feedback and sort of check-in sessions to continue your growth and sort of learn from those around you in the unit.
Hi. Well, during preceptorship, we actually check in with our preceptor every single shift. So throughout the shift, you're communicating with your preceptor, you're working side by side, but at the end of the shift, because I was trained on nights as well, the preceptor would sit me down and say, okay, let's go over what happened today. Let's talk about any concerns that you may have had. Do you have any questions? Or this is what I observed. Could we set this as a goal for next shift? And things like that. It actually really helps you as a nurse resident to build your confidence and to help you see things that you don't realize that you could potentially use work on. But in addition to that, you get to meet with your nurse educator. You get to meet with the management team that gets to say, okay, this is how we feel, Aimee's doing during this time frame. Nurse educators there to help facilitate that and to help say, okay, what goals are we going to set? So the next time we meet in a couple of months, you could give us feedback. But the good thing is all of them always have their door open and say, if you have any questions, if you're struggling with something, please connect with us. Don't wait until our next meeting. If you want, additional help or if you need resources, that's the great thing about this residency program. You feel so unbelievably supported that it's really hard to fail. It's hard to not become a great nurse based on all the support that you're actually receiving, not just from your management, not just from the educators, from your cohort. We communicate with each other and support each other. We have questions, we ask, advice, but also your peers. Once you tell people that you're a nurse resident, it's like they're happy for you. They want to see you succeed. They always come up to you and say, hey, do you have any questions? Can I support you? Do you need any help? So this program is amazing. You're going to feel completely supported in it.
I resonated with what Aimee says. I think every couple of months, I think I've had 3 or 4 check-ins. There's a nursing professional development specialist that kind of follows you throughout your nurse residency program. And so they organize check-ins with your preceptor, your managers, and you present, and you kind of sit in a room and talk about things that went well and things that you want to improve on. And there's always follow through on that, right? So we'll have a meeting where I talk about things that went well and things I want to improve on. And the next meeting, they'll ask me follow-up questions on, oh, did you work on these things and how did you improve? So not only do they meet with you, but they keep track of what you said in the previous meetings and hold you accountable for the next meeting. And I think that really shows initiative on their part, and they want to see you grow. They want to see you improve, and they want to make sure that you're doing well as well. So I think, having that nursing professional development specialist follow you is really helped me grow in my nursing career. And not only that, my preceptor is always available. Even after I'm solo, I can always ask them questions. And, I always find time to ask people questions when I'm charting. If I'm sitting next to them, I have a question, I can ask them, right? And so not only am I supported in this official setting where I'm having meetings every couple of months, but I'm also supported unofficially. I can go to the manager's office at any time, or I can talk to all of the experienced nurses on the unit. And so I think the combination of that support system has really helped me grow as a nurse and be confident in the fact that I have people around me who have my back, right? And obviously nurse residents and cohort members are the same too.
I concur to both what they said. Daily feedback on a shift by shift basis with your preceptor, even after something major happens or something that you did really well. In the moment, my preceptors were like, "Oh, that was great. You did a really good job at this," or "Let's do that." People are always asking, "Do you need anything?" It's not like in a demeaning way. It's always, "Hey, are you good? You okay? You doing all right?" It's never in a, "Oh, they think you're doing bad," or "Are you struggling?" kind of thing. It's always positive. It's always meant to be positive. Always the check-ins with your managers, and your charge nurse is always coming around, seeing if you need anything. So I agree. It's very supportive.
So we're hitting our time limit, but I want to just two more things. I want to turn over to Carly for one moment for an announcement from talent acquisition, and then we'll close up.
Yeah, thanks, Kerry. Just wanted to give you guys one quick update. In accordance with California Department of Public Health's new orders, as well as Santa Clara County's health department's requirements, effective when you guys will be coming on, because this goes into play in 2 weeks, we will be requiring all clinical patient-facing hires to have the booster vaccine if eligible. And you will also have to be fully vaxxed, obviously prior to that. So please keep that in mind. We cannot bring you on if you are not fully vaxxed. And within 6 months, you will be required to have the booster vaccine. If that is not something you're comfortable with, unfortunately, we cannot bring you on. So just being fully transparent, we are just following the state health department's orders at this time, though.
Thanks, Carly. So I want to thank all of you. I see some familiar faces, which always makes me really, really happy. One of the things that I find is so incredible is if you go back and you look at any of the previous webinars, for example, you'll see Leslie on one of the previous webinars as a student listening in, and Daniel and Aimee the same, and now they are providing guidance. So I am excited for all of you who will be interviewing with us at the end of the month. Carly is still working diligently on reaching out to candidates. If you are not interviewing with us at the end of the month, please apply to our August program. With that said, there are many incredible residency programs within the area and throughout our country. And so as much as I love Stanford, I started here as a new grad. We need nurses and healthcare. We need all of you. I think it's the best job. It is the hardest job in the world, but it is the greatest job. So don't sell yourself short. Go out there. We are so excited for all that you're going to contribute to all of the patient care throughout California and beyond. So for those of you who recently graduated, congratulations. That is a huge accomplishment. For those of you who are in school, best of luck with these next semesters. Feel free to reach out to me. Take care, you guys. We'll see you soon. Bye.
Thank you so much.
Thank you.
Thank
you.
you.
Thank
you.
you.
Bye.
So much.